Expedia and Visit Scotland invite you to come experience the beauty that awaits in Scotland. The sweep of wild coastlines, quiet lochs, and untamed landscapes. Fresh cuisine that feels rooted in the land. Come experience the kind of stillness that stays with you long after you leave. Plan your Scottish escape today at expedia.com/Visit Scotland.
Blowing ad budget on metrics that look great till the CFO sees them. That's bull spend. And marketers are calling it out in Dashboard Confessions.
I remember telling my boss, it'll be good for the brand, when leads were slow. Yeah, it wasn't.
Cut the bull spend. LinkedIn lets you target by company, job title, and more. Advertise on LinkedIn. Spend $250 on your first campaign and get a $250 credit. Go to linkedin.com/campaign. Terms and conditions apply.
You know, we're the wealthiest country in the history of civilization, and we throw away more food every day than is necessary to solve hunger. So this is not a situation where we have a food crisis. We have a crisis of political will. And the best remedy for that is for everybody to lift up their voice, to be in touch with their senators and their member of the House of Representatives, and to strongly advocate that there should not be cuts to SNAP, Medicaid, or Medicare. And if folks are looking for an easy way to send an email to all three of those federal elected officials, they can go to the website feedingamerica.org/SNAP cuts. And in less than a minute, they can fill out a quick form which will send their communication to all three of their congressional representatives and senators.
Hey everyone, this is Jonathan Marks with Go2 Health. Welcome back to another show. We hope you are enjoying your summer. Our show today, I'm going to get right to the topic. Congress is considering a bill that would significantly reduce funding for SNAP, which is food stamps. Also, Medicaid and Medicare. Even though Medicare was promised not to be touched, you'll learn how Medicare will be affected. These are three programs that play a critical role in helping people meet essential needs. For many families, this couldn't come at a worse time, as summer brings higher expenses and the cost of food and health care remain out of reach for millions. SNAP helps 42 million people, including children, seniors, and working families who rely on both programs to cover essentials like food and medical care. It also plays a key role in local economies, supporting jobs and small businesses, with every $1 generating $1.50 in economic activity. If the legislation is passed, it could take away enough food for 9.5 billion meals on average every year. By comparison, the Feeding America network of food banks, meal programs, and church pantries across the country provide 6 billion meals each year. Medicaid could face the largest reduction in its history, with $716 billion in funding at risk. This could cause millions to lose their health insurance. If 7.8 million people lose Medicaid, about 780,000 more might not have enough food to eat. The bill also proposes a just incredible $500 billion cut to Medicare, making it harder for millions of older adults and people with disabilities to access health care. Our guest today is Vince Hall, the Chief Government Relations Officer at Feeding America, which is a network of food banks across the country. Vince leads the development and execution of Feeding America's public policy, legislative, and advocacy strategies to empower communities and improve food security. And with all the bad news about this big, bad, beautiful bill, Vince will tell us what we can do to make a difference. So, welcome to the show, Vince Hall. How are you today?
I am well, Jonathan. Thank you so much for inviting me on.
Sure. So tell us first, what is SNAP? What kind of program is that, and who does it serve?
The SNAP program was begun in the 1970s in its current state. It is sometimes referred to as food stamps because in the early days of the program, there were literally voucher books with stamps in them. And the program converted to the use of an EBT card, which is like a debit card, but essentially it's a federally funded program that is administered by the states in a confusing way. Some states don't refer to it as SNAP. They call it something unique to that state, like California calls it CalFresh. But the program is still SNAP at its core, whether you call it something else or not. And essentially, based on a strict formula that evaluates a family's income and compares it to the expenses of their monthly essentials, establishes whether they are economically qualified to receive SNAP benefits. Those benefits come on the EBT card. It is recharged once a month. And within that month, families get some money to help purchase food at a local grocery store. The card can only be used for food. And the amount of money on the card averages about $6 per day for each recipient. So it's not a lot of money, on average $187 per person, but it does help. And it is particularly critical for the 42 million people that currently rely on the program, because hunger and food insecurity are so high in the United States right now, the highest they've been in over a decade, and continuing to climb. The people on the program are largely seniors, children, people with disabilities, but also people who have just fallen on hard times. They've been laid off from work. They're in that transition from one job to another. They might need to get some job training and develop new skills. But the program essentially helps people who are unable to work or people who are between jobs. And it is very successful in lifting millions of people out of poverty, helping them to gain a toehold in the workforce if they're able, and to proceed on a path to economic self-sufficiency. So the SNAP program provides about 9 meals for every 1 meal provided by America's food banks. So the scale and impact of the SNAP program is enormous and positive.
Do the states fund SNAP as well, or is it simply a federal funded program?
Well, Jonathan, that's a very timely question, because historically the states have split the cost of administering the SNAP program 50-50 with the federal government, but have never been asked to pay for the cost of the SNAP benefits themselves. The SNAP benefits have been entirely federally funded, because that's a way of making sure that every person in the program is treated equally and fairly given their economic circumstances and the number of people in their household, regardless of what zip code they live in. Now, unfortunately, under the bill that's pending before Congress, that could all change in a very negative way.
I understand that there are many bills, and Project 2025 is really trying to push a lot of benefits from the federal level to the state level, and the states are simply not prepared to take on these kinds of costs and benefits for people that's never been in their budget, and this will simply go by the wayside if Congress cuts these benefits.
That's exactly right. The states are largely seeing declining revenue and have their own serious budget challenges in most states. And so asking them to absorb huge new costs associated with SNAP administration and SNAP benefits for the first time ever is something they're ill prepared to do. And the bill pending before Congress right now, the so-called Big Beautiful Bill, would in fact also force the states to absorb huge cuts to the Medicaid program, and they would see more need in their communities because of cuts to Medicare. So the combination of the SNAP cuts and the Medicaid cuts and the Medicare impacts is extremely dangerous. We estimate that the cuts proposed for the SNAP program in the bill pending before Congress right now would take 9.5 billion meals off the tables of people facing hunger in this country per year. Now, the entire productivity of the Feeding America network, which is most of the charitable food system in the United States, is only 6 billion meals per year. So the cut that's being proposed at this moment is 158% the size of the entire output of the charitable food system. And we're not, unfortunately and tragically, we're not able to reach every person facing hunger today. We are stretched for resources. America's food banks are serving the greatest percentage of the population in over a decade.
Yes.
They're doing so with diminished resources. Fundraising has declined since the height of the pandemic. And so to cut the budget for SNAP and these other programs doesn't mean you're cutting hunger. And it just means that you're transferring the responsibility of addressing this problem from federal nutrition programs to the charitable food system. But the charitable food system simply does not have anywhere near the capacity that it would need to serve this many meals. 9.5 billion meals per year is far beyond the most wild expectations of what our local charitable food system could do.
Right. And what I understand, too, is the state budgets can't afford this. They're already struggling with maintaining health care benefits at the state level. And the only way they could afford more is by raising taxes, which I don't think anybody's going to do or want to do. So we're really going to see cuts to the program in general. Now, I've heard many, many promises that Medicare won't be touched, but you just suggested that Medicare is going to be affected in the new bill. What's in there that's going to affect Medicare?
The fact is that the Congressional Budget Office, which is a independent, respected, nonpartisan authority that provides official analysis of legislation for Congress, has estimated that the bill pending before Congress right now could lead to a $490 billion reduction in Medicare spending over the next decade. Wow. Those cuts may result in a 4% annual reduction in Medicare funding starting next year, which could impact severely payments to healthcare providers and potentially increase costs for Medicare beneficiaries. That all comes about because there is existing federal law that requires so-called sequestration of funds. So if Congress increases the deficit at a certain rate, then sequestration kicks in, which mandatorily reduces spending across a broad array of federal programs, including Medicare. So while you won't see Medicare cuts called out specifically in the bill that's currently pending in the U.S. Senate, the underlying federal fiscal policy is that because of the increase in the deficit that would be funded through this legislation, the Congressional Budget Office is predicting that you would see almost a $500 billion reduction in Medicare over the next decade. That's different than the Medicaid cuts, which are explicitly called out and total approximately $700 billion in the text of the bill currently pending.
And what kind of effect would the $700 billion cuts in Medicaid have on families?
Well, this is going to dramatically reduce access to preventative health care or even just primary care or people all across the country who can't afford or don't have access to private insurance plans. And as a consequence, it's expected that many nursing homes, which are heavily reliant on Medicaid, will not be able to survive financially. There is a severe consequence for hospitals and community clinics, particularly in rural communities that have a much higher dependency on Medicaid payments to keep their lights on and their doors open. This is an unprecedented cut in the size of the Medicaid program. It is almost hard to put into words how significant a reduction this will be. We know that Medicaid already provides help to roughly 70 million people in the United States. We know that the SNAP program helps about 42 million people in the United States, but about 40% of Medicaid recipients also participate in the SNAP program. And so the impact on those individuals is going to be even more severe as both their health access is compromised and their access to food purchasing power is compromised. So it is a double whammy, and there are about 780,000 more people in this country who are estimated to become food insecure as a result of the Medicaid cuts, never mind how many more people will be food insecure because of the SNAP cuts.
Yeah. So Vince, before I want to ask what we can do about this, if you have a way, I want to learn more about feedingamerica.org. Tell us about your organization and what you do.
Thank you for asking, Jonathan. The United States is fortunate to have a very robust system of food banks that are all locally incorporated organizations. They're local nonprofits. They're run by people from the local community, and the money that they raise stays in the local community. Feeding America national organization, which is feedingamerica.org, was created by those local food banks to serve as a national umbrella over all the local food banks in the country, of which there are, almost 300 when you count partner food banks, affiliate food banks, partner state associations. There's nearly 300 members. But more importantly, or as important, they are connected to 60,000 faith-based and nonprofit organizations who depend on food coming out of those food bank warehouses to operate their pantries, their soup kitchens, their church pantries, any number of food distribution sites. And 60,000 of those entities are engaged in the distribution of food that comes out of those food banks. Those food banks are heavily dependent on donated food and volunteers. And yes, we're very fortunate that in communities all across the country, people find time to help that food bank through donation of time, through donation of money, which is extremely important, through donating food, and then finally to donating their voice, to being actively involved in helping to raise up the needs of the food insecure people in this country and being advocates for them. I mean, 1 out of 7 people in the country are struggling with hunger, which means by definition, we are all in community with somebody who is struggling with hunger, whether we know it or not. I mean, it's somebody in our kids' classroom, somebody in our workplace, somebody in our faith community, or someone who lives down the street from us, but we are all in community with people who are struggling with this issue. And oftentimes it is difficult for them to speak up for themselves, but we're the wealthiest country in the history of civilization, and we throw away more food every day than is necessary to solve hunger. So this is not a situation where we have a food crisis. We have a crisis of political will. And the best remedy for that is for everybody to lift up their voice, to be in touch with their senators and their member of the House of Representatives, and to strongly advocate that there should not be cuts to SNAP, Medicaid, or Medicare.
Got it. So as an umbrella organization, are you mostly a political representative organization for all these different food banks around the country? What are your functions?
Oh, well, we're very nonpartisan. We work with Congress, the White House, USDA, here in Washington to try to advocate for good, strong, robust public policies to address the issue of hunger. But that's actually just one part of what the Feeding America National Organization does. One of the largest things that it does is to identify national level partnerships with grocers and with agricultural producers and transportation companies. And essentially at every point in the food supply chain, there is excess. At every point in the food supply chain, from the farmer that grows the crop in the field to the local grocery store that sells it to the community and everything in between, Feeding America food banks are able, through the national organizations' agreements with these national organizations, to access the food, to rescue it before it goes to waste, to bring healthy, nutritious foods to families in need in communities all across the country. The national organization also raises funds at the national level and is able to devote more than half of its budget to making grants to the local food banks to help support their operations and supplement the money that they're able to raise in their local communities. The food banks also share best practices through the national organization. So when somebody in Ohio innovates a particularly creative new program for, say, food as medicine, many food banks all across the country are quick to learn those lessons and to apply the solutions that worked in Ohio in their local community. There's a real sharing of ideas and innovations and best practices across the network. So the national organization, feedingamerica.org, plays a critical role in helping local food banks to thrive and succeed in their mission.
Great. So if you want to learn more, you can go to feedingamerica.org/snapcuts, and SNAP stands for the Supplemental Nutritional Access Program. And you can go there to learn more. Vince, as we end today, what's the best way for people to take action? I mean, one of the things I heard you say is to support your local food bank, but what are other ways we can help people prevent these cuts to Medicaid and Medicare and SNAP?
Well, thanks, Jonathan, for asking. It really is a good idea for everyone to get in touch immediately with their member of the House of Representatives and their 2 senators. Sometimes people feel that they call their Congress member's office and express a point of view and they're done. In this moment, it's actually every bit as important to call both of your U.S. senators' offices and to express your point of view to them as well. And if folks are looking for an easy way to send an email to all three of those federal elected officials, they can go to the website you just mentioned, feedingamerica.org/snapcuts. And in less than a minute, they can fill out a quick form which will send their communication to all three of their congressional representatives and senators. So, and being in touch with the local food bank, letting them know that you want to be an advocate for solving hunger is also a great way to get involved for the long term.
Great. So that's brilliant what you just said. People can go to feedingamerica.org/snapcuts, and there you can get in touch with your members of Congress and your state senators immediately to let them know that you don't want these cuts to these federally funded programs. Thanks so much for being with us today. What's the last message you'd like to leave with people, Vince?
The last message is that hunger is affecting 1 out of every 7 people in our country, and it need not. We have the ability and the know-how and the food to ensure that every person in this country, the wealthiest country in the history of civilization, is fed and nourished and healthy. There is nothing good that comes about from hunger, and there is nothing but good things that come about by ensuring everyone has access to the nutritious food they need.
Great. Thanks so much for being with us today, Vince. We've been talking with Vince Hall. He's the Chief Government Relations Officer at Feeding America. He leads the development and execution of Feeding America's public policy, legislative, and advocacy strategies to empower communities and improve food security. Again, Vince, thanks for being with us and sharing this important information.
Thank you so much, Jonathan.
Good. And this has been Jonathan Marks with Go to Health. Remember, you can watch us on YouTube. You can watch us at our website at gotohealthmedia.com, and you can listen to us on 8 podcast networks. We're enjoying 10,000 plus downloads per day for our show. We thank you for your interest and loyalty to our program. Again, this has been Jonathan Marks, and as we say at the end of every show, go to health. We'll see you again next time. Take care. God bless. Thank you for tuning in today to Go to Health. You are one of almost 10,000 people per day who enjoy the evidence-based health information offered by our guest health experts. You can watch us on our website and YouTube and listen to us on 8 podcast networks. Be sure to join Jonathan Marks in our upcoming shows each week. If you like our show, please share this episode with your friends and colleagues. You can subscribe to the show, join our email list, send us feedback, browse through the online store, and view our library of over 150 shows at gotohealthmedia.com. See you next time, and remember to elevate your life with Go to Health.